What's up, YouTube? It's your friend Greg J. Hannibal the Radio. Today, I want to continue a discussion about the election. Voting for change. Vote for change. Oh my goodness. We must go to the polls and cast our vote for whomever we feel is the most qualified to run this country in this next administration. Particularly black people. You know, we need to really fill up those polls. It is our cultural heirloom. People have fought and died for our privilege to cast our vote. You could just go to your history books and see story after story after story about how we were prevented from going to the polls, from Reconstruction and the Emancipation all the way through the mid-1960s and even a little bit past that. You know that the struggle for the simple right to vote has been a major issue on our agenda. And then with a new administration coming in to replace this regime run by Bush 2. Oh Lord have mercy. Do we not need change? So the black vote is very, very important. Now Obama is running in this day and time. Oh my goodness, a black man, an African American, has a very good chance of being the president of the United States. In these days and times, a woman, Hillary Clinton, oh my goodness, has an excellent chance of being the president of the United States. However, we must examine whatever vote we cast. We must examine what each candidate stands for. Now, for black people, we need a black political agenda. That is items that we want to see our legislators addressing in Washington, D.C., which are going to affect our society, our communities. And I asked Dr. Cornel West when he was in and consented to an interview for my YouTube channel. You can see that on there. I asked him what a black political agenda looks like. And he recommended that we follow Tavis Smiley's Covenant with Black America. And I went to the website, and you can see the website and the link in my video description. And I see that there are a number of items that we should pay attention to. I will list them here, okay? The first one, though, in this blog that I want to talk about is healthcare and well-being.
I'm in this race because I'm tired of talking about the outrage of 47 million people without health insurance. I want to start doing something about it. And that is the reason why, as president, I'm going to put forward a proposal that says every single American can get health care that they can count on, that's as good as the health care I have as a member of Congress. And we're not going to do it 20 years from now. We won't do it 10 years from now. We're going to do it by the end of my first term as president of the United States. That's why I'm in this race. That's why I'm in it.
Well, I will pledge to you that I will get up every day in that White House worrying about what I can do to make life better for every single American man, woman, and child. And that starts with health care for every single American. As Kevin knows so well, nobody who's in the system is happy with it now. Doctors, nurses, pharmacists, hospital administrators, employers, workers, nobody's happy. And why? Because it's not working for anybody but the insurance companies and the drug companies. And let me ask you, how many of you know somebody, doesn't have to be you yourself, but how many of you know somebody who doesn't have health insurance?
That's one of us.
More black people are dying from diabetes, brothers are dying from prostate cancer, sisters are dying from diabetes, heart disease, breast cancer, at rates that are far higher than the general market, okay? We have to have great health care in our community. Now, maybe when we have jobs and we have good health insurance, oftentimes what the studies will show, if you go out there and just Google healthcare and African Americans, you'll see study after study that quotes disparities in healthcare when it comes down to African Americans. But the main thing is that even if we have healthcare, health insurance from our jobs, we may take our families to the doctor that is in our community, but in our community the doctor doesn't have as much access to the top medical technologies that some would have in other communities. Maybe the doctors don't have the relationships with the specialists that we need to address the diseases that are prevalent among African Americans. These are widely discussed issues within the medical community, and there are a lot of medical activists who are out there trying to promote changes in the healthcare industry that will improve the conditions, especially where it comes down to dealing with the black populations here in the United States. Well-being has everything to do with us taking care of ourselves. So we need to be physically fit, we need to exercise, we need to eat right. The foods that we eat, that we traditionally eat, are not necessarily good for us. And we have to start getting educated on what is good to take into our body. The education needs to get to the masses of the people through the churches, through the places where we frequent. So that needs to be addressed. And I know that the government can help promote well-being in the black community. So I want you to go to Covenant with Black America. Look at healthcare. Okay, it's important. You know, if you're married, I mean, you know, your woman is going to go to the doctor and go to the doctor far more than you are. If you have children, brothers, you know that you want to make sure that your kids have good, solid health care. And you know, it costs a lot. Maybe your job only offers minimal health care. We've got to find out how the government can step in and help augment the healthcare system for us. We've got to figure out how we can bring quality health care, quality health information into our communities, and that will help us and our children build generations to come. So healthcare and well-being are the items that we want Barack Obama, Hillary Clinton, or even the Republicans, if you want to go that way. We want them to bring healthcare. So there we have it. Healthcare, well-being, taking care of our seniors, you know, reduction or price controls on pharmaceuticals. We need to reduce the role of the pharmaceutical industry, or check that, you know, because they're causing the cost to be so high that the everyday people, mama and them, big mama and them, can't afford the proper medicines that they need. Some people have to make a choice whether to eat or get their prescription. We need to find out how we can control that and how to provide each and every American with a quality of life, and they're not making such drastic choices whether I'm going to have dinner tonight or whether I'm going to have my meds. That's a serious consideration, particularly for a senior to have to deal with. All right, so we want to challenge those candidates. Let's start looking at what they're saying about healthcare. Let's start trying to see what we can do as Americans to bring forth a national healthcare plan. What is Hillary saying about it? What's Barack saying about it? What's Mitt Romney saying about it? Huckabee? All those guys. What are they saying about healthcare, and how does that impact us here in the black community? All right, YouTube, God bless you. Be well.